Good afternoon, North Dakota. Thanks for tuning in. On March 11th, 2020, we experienced our first case of COVID in our state. And for several months, we watched from a place of relative safety, protected by distance, in a world that had virtually stopped traveling. And we watched as deaths and disease mounted in Italy and Spain. And then it came to the United States through both coasts. In the Northeast U.S., we watched, and I met with governors as part of our weekly governors meetings, where we saw states such as New York and Connecticut and New Jersey heartbreakingly lose more than 1,000 citizens a day during a peak of that spring onslaught. We knew that as it came, there was fear and concern and lots of unknowns, and there was a national narrative that was saying, hey, everybody needs to issue shelter in place, everyone's got to issue stay-at-home orders. There was a lot of pressure coming from both coasts, but in North Dakota, we navigated a course that worked for North Dakota. We kept our economy open, we kept our health care open for elective surgeries, we kept our lives moving ahead. And since the beginning of that pandemic, North Dakota has charted this path that has worked for us. We have resisted some of these cries for things that perhaps were needed in other places, but we kept our health care capacity available and our deaths among the lowest in the country. School districts last spring built plans and capability in record time to empower teachers and parents to deliver distance education when other parts of our country simply stopped education completely. This fall, we empowered local school districts and our universities to safely reopen for in-person learning when many schools still remain closed around the country. We improved our knowledge as a country and as a state and healthcare system in the treatment of serious cases, and we've substantially reduced the length of hospital stays. One time they were close to 20 days for a stay. Now they're down to just over 7 days, which is, again, adds to our hospital capacity. We built testing capacity to lead the nation, and we still do, and we're among the leaders in the nation allowing safe visitation and long-term care, and you'll hear more about the work on that front from Chris Jones today. Throughout this, we have also focused daily on the non-COVID effects of mitigation, and we've been delivering new services to help those whose battles with behavioral and mental health or disease and addiction. And we've also been executing in collaboration with the legislature on executing billions of dollars of federal aid from both the feds and the state to aid businesses and individuals whose livelihoods have been disrupted by the pandemic. We've been able to do all of these things at the same time while protecting the freedoms that we all cherish as Americans and as North Dakotans, ensuring that our rights to free speech and our rights to vote in safe, secure elections remain untethered and untouched. And now, on top of this incredible record that we've had for the last 7 years, we as North Dakotans find ourselves in the middle of a regional COVID storm, and we face new challenges and find ourselves facing additional adversity and perhaps deadlier outcomes. And we're doing this at a time when perhaps our citizens and parents and many are fatigued from the stress of managing this for so long. But successfully slowing the spread of a virus, as we talk about our strategies to save lives and livelihoods, is dependent not just on government, but it's dependent on the millions, literally the millions of decisions that are made by our 760,000 individual citizens each day. The choices that each of us make has affected our trajectory and continue to affect our trajectory. And this has always been the case in public health. Public health is based on individual choices and individual actions. And those individual actions are often based on beliefs. And every aspect of dealing with this pandemic, from testing to social distancing to face coverings to vaccines, has been debated, it's been challenged, and unfortunately, and perhaps because it is a presidential election year, they've all been politicized. This creates a very difficult operating environment for our public health leaders and officials and frontline workers, because the conflating of public health measures with national political debate, creates challenges for all involved. And this is especially felt by our local leaders, whether you're a mayor, city commissioner, county commissioners, school board members that are elected, park districts, et cetera. And I do want to say a word of gratitude for all of those local leaders who are out there in the arena battling through this uncertainty. These political divisions and divergent political philosophies have always been present in America since our founding, but they're amplified during times of great stretch, such as the pandemic we're facing today, and then perhaps today multiplied even more by the emergence of pervasive social media. And this has led, again, to one of the challenges we face, because there are portions of America that believe that they have the answer, and that the opposing side is not just wrong or has a different opinion, but they're actually crazy. And so when we have these deeply held beliefs, those beliefs that people have on opposite sides of a spectrum, or multiple sides, because sometimes it's more than two views coming at the uncertainty that we face, we have a hard time building consensus around collective societal action to go forward. We know that, and this oversimplifies it, in the pandemic, we know that there are some that believe that if either the federal government or the state would just issue more mandates or restrictions, that all would be solved, that there's somehow some kind of magic bullet that government holds. There's another side that believes that any actions related to serving the greater good of public health are in fact infringements on their personal rights. And so it's more important than ever, as we navigate and through these challenging times, that we find a new center, that we find tools that can really work. And we've alluded to this at past conferences, and I think it's important to the future of our state that we do understand that there is something that is more powerful than an executive order, or infinitely more powerful than a mandate. And these are the beliefs that individuals hold in their hearts: compassion, empathy, understanding, and dare I say, actually love. We've talked at these conferences about finding your why. Why would you change your individual behavior to help slow the spread of a potentially deadly disease that might not affect you, but could kill somebody else? Why would you do that? We said find your why. Today I'm going to say, let's see if we can find our love. There are many religious practices in our world that at their heart all contain basic elements of love thy neighbor as thyself. But I would say that we know that we're seeing it today in our schools, that we've got people that are masking up because they love their teammates, they love their school, they love their classmates, they love their teachers. I had an opportunity to talk by video conference to 4 second grade classes at John Hoven Elementary in Minot the other day, and a lot of happy kids with a lot of interesting questions, and all of them wearing masks, 100% of them, and all of them as energetic and inquisitive and curious as you would ever hope any group of second graders could be. But maybe your love is for the small business owner that's struggling to keep going, but maybe that small business owner is a spouse or a friend. Maybe your love is for the healthcare workers that took care of one of your loved ones, or maybe you're married to one of those healthcare workers. We can certainly we have got strong cultures. Our tribal nations have a deep culture of love for their elders and respect for those elders. And certainly we can have a love for the vulnerable of all ages, children with cancer or others that have underlying health conditions. And I know, coming from my hometown, that there's a love of your hometown, a love of your community, a love of your neighborhood. And I say, certainly we have a lot of love for our schools and our teams. And I would like to think that there's a love for North Dakota, for our state, which many of us who are in public service are here because of that love. The path towards freedom that we seek, which includes freedom from COVID, freedom from having the life-changing elements that we're facing because of this pandemic, This is a path that requires us to understand our own role and the impact of our own individual choices. When we think about love, one of the core tenets is the rights and feelings of others being placed before yourself. So each of us, if we look inside of ourselves and look to those around us, we each of us know that we actually have a role to play in saving lives and livelihoods. It's not a job for government. This is a job for everybody. And we know that each of us has a role to play in keeping our kids in school and keeping our businesses open, keeping our economy growing. So today is an invitation. It's an invitation for us to take action as individuals and as a community level. It's an invitation for collective action to make a difference, to show those that we love, whether it's our elders who rightly should be afraid of premature death, to also the love to show our children, what leadership looks like, what parenting looks like, and what love of community looks like. And we have an opportunity to show each other and to show our nation that North Dakota is so much more than a misrepresented statistic in a national narrative. I believe in North Dakota. I believe in the goodness of humanity, and I believe that North Dakota will rise to the challenge and emerge stronger than ever. And I also believe that we have local leaders that will lead. We're certainly seeing this now as mayors and other leaders step up. But you don't have to be an elected leader to lead. You can be a resident assistant in a dorm on a university and be a leader. You can be a teacher in a classroom and be a leader. You can be a parent, or you can be just someone in your neighborhood. You can be a business owner and say, I'm going to lead in terms of protecting the team members and the employees that work for me. So we truly do have a need for leadership, and I believe that we have that. And the time is more important than ever because, as I said, we are caught in the middle of a COVID storm. If we take a look at a slide, positivity rates, we can see that this is the positivity rates from the last 7 days. We showed this chart for the first time last week, but this chart would have been quite boring through March, April, May, June, July, August, and even in September, because we were living in the upper Midwest and the Eastern Rockies where the pandemic had not yet, the waves of the pandemic had not reached us. And perhaps that gave us a sense of complacency, or maybe a sense of invulnerability that somehow, or even a sense of pride that somehow we were going to avoid this thing. But we know that, and we see in the numbers here, whether it's from Illinois to Idaho, with states, bracketing us, Wisconsin and Idaho with 20+ positivity rates, and in states like Wisconsin, which have had mask mandates since July, it's what individuals do. It's not what government says. And so, but we find ourselves still in a spot in the midst of this storm where we've got the third lowest positivity rate in this region. So while we're on a dangerous trend line, a trend line that is where percent positivity and active cases continue to increase, and where October has been the deadliest month so far for North Dakota, we still have an opportunity to act if we act now. We reported another 8 deaths with COVID today. That brings our total for October so far to 98. Comparing that to 120 in September, and 120 in September was more than all the other previous months. And the month isn't even half over yet, the month of October. Just to give people a sense of if they think that we're on a good course or not, we're averaging 7 deaths a day so far in October, and at this rate, we'd have an additional 504 deaths of North Dakotans with COVID by Christmas. But as I say, each of us has it in our power to help change that trajectory through our actions, and through our leadership, we can help change that for others. So now is the time for us to as North Dakotans do, to buckle down, to step up. And in this case, we need to make some small investments. And we need to make those small investments in behavior changes that are free and don't require government subsidies before we're forced into a situation that other states have been forced into, and where we found ourselves last spring when we were facing the unknown, which is we had to make choices like closing schools to in-person instruction and restricting access to some of our businesses. But all along, we've also said we need to protect our most vulnerable. With increasing community spread that we're seeing right now, increased risk of COVID getting into our long-term facilities is apparent. And now 50% of the 218 long-term care facilities in North Dakota have had healthcare workers with positive cases. That's the highest in the nation right now in terms of active cases. And of course, we remove those healthcare workers from that space, but that creates pressure and shortages to serve those vulnerable populations. And we need to have a behavior change to help protect those most vulnerable. And again, when we talk about community spread, this is in infections in long-term care facilities, then it's a reflection. The infection rate in the long-term care is a reflection of the healthcare workers. The healthcare workers is a reflection of the community. And so again, take awareness. Is there a long-term care facility in your community? Is there community members that live in your community that work in long-term care? The answer is yes, for virtually every part of our state. But in particular, if you're in a community that houses those in long-term care where we know their congregate locations is highly vulnerable, I would think even harder about having a community discussion of what mitigation you need to put in place in that community to protect your loved ones and your neighbors in that facility. Last spring, we had a tremendous togetherness, and we need to rekindle the hearts in the window spirit that we had then. And it's not something we need to do forever. We need to do it long enough to bend the curve. We need to do it long enough to slow the spread, and we need to do it long enough into 2021 so that the other tools may be at our disposal, including vaccines that can help protect the most vulnerable. Again, the mitigation strategies are clear. There's not a mystery. What we've been talking about since the beginning is what works. Distancing works. Masking works. Limiting your presence at large gatherings works. Washing your hands works. Staying home when you're sick works. All of these things work. We do not need new mitigation strategies. We just need to execute on the strategies that we know that work. The virus is insidious. It only transfers from human to human. That's the only way this thing can move about. If we give it an opportunity to transmit, it will, and it may do it without you even knowing that you're the transmitter. As a state, we need to continue to deepen our collaboration and support with local leaders on action that's appropriate for their communities and regions, because each community has got different culture, different approaches, different tools, different local public health. They're different whether they have a university in the community or not. But those individual differences is why we have to have localized approaches and local leadership. This morning we had a great and frank call with 14 mayors from around the state's largest cities. They shared with us their biggest concerns and their concerns about what they need more from the state. They discussed strategies that they're using to increase compliance with guidelines we have, and we talked about how we can best support them. Those 14 mayors are in key positions. Their cities represent 61% of the population in counties that represent 78% of our population and 76% of our active cases. So there's a group right there, again, that can make a big difference. We appreciate their input, and we also appreciate yesterday's letter from the mayor of our fourth largest cities that urges citizens to wear masks when distancing can't be maintained, to wash hands frequently and sanitized, frequently used surfaces, particularly in businesses. We wholeheartedly and we applaud the leadership at the local level. And we support these recommendations because they're the same ones that we have advocated for week after week after week since the very beginning. We recently incentivized mask wearing by updating our quarantine guidance so that close contacts don't need to self-quarantine at home if both the positive case and the close contact were wearing face coverings consistently and correctly for the entire time of exposure. This has allowed hundreds of school kids to get back into school. The feedback from parents and from schools on this change on mask wearing has been positive, and we've seen an uptick in mask usage in schools because now students are incentivized. We need to think think about the same kind of incentives locally for adults to help people understand that when they are in it together, this is the same way we can help keep kids in class and keep them in sports and in their activities. It's the same way we can keep healthcare workers on the front line and keep death out of our long-term care facilities. When we jump to the numbers that we're looking at today, again, we are at 4,120 new cases, 2,247 newly recovered, and 61 deaths, as I shared. But that puts us now, netting out the recovereds from the new, at a new North Dakota high of 4,759 active confirmed cases. Again, this is part of this trend line that we need to acknowledge that is going the wrong way, and we need to take action at the local level to make sure that we can help turn the corner. With the 4,120 cases out of a record 49,106 tests over the last 7 days. That brings our test rate, the 7-day test rate, to 8.4% among all North Dakota tests completed. Looking ahead on testing, in the near term, we have some good news. As I've said, the testing program that we have is about ready to get more robust. With the work of the federal government and the White House Task Force, we currently now have in-state, have received shipment of about 58,000 of the rapid as in 15-minute, highly accurate Bionox Now tests. And those are spread between our state cache, and some have been shipped already to long-term care facilities. Before deploying those, we're validating those tests this week, and then we're also working through the data and software issues to be able to feed the results from those tests into our reporting system. So in the future, we'll be reporting not only the PCR tests as we have been, including today, but we'll also be reporting separately the number of antigen or quick tests that are occurring going forward. And again, we anticipate that using these rapid tests at long-term care facilities to help protect the most vulnerable, help with our healthcare workers, and to facilitate visitation. If we have extra tests over, there's an opportunity potentially to use them to support education. Our 14-day state positive rolling average, as I said, it's lower than the region, but today it's 7.9%. It's more than 2 points higher than it was a month ago. And as I said, it's, the trend line is disturbing because it continues to rise. As we've talked about with the 61 deaths, and as we've said every week, that our hearts go out to the families and friends who've lost loved ones. But for those that might think that this is just a trite saying, know that on behalf of the First Lady and Lieutenant Governor Brent Sanford and myself and everybody that works in public health and works in healthcare, that whenever a patient is lost, whenever a loved one is lost, it weighs heavily on those of us that are working hard to save these lives. We know that each of these are individuals with lives lived, and they're not statistics. One of the things that's been most troubling to me is I have actually heard people say, and they've said it in person, they've said it to me, they've said it online, something that I find just incredibly disturbing to say, well, these people would have died anyway. Well, it is a fact that all of us who are here on earth are going to die anyway. But in America in this day and age, if someone is in their 70s, they have a right to expect that they might live into their 80s or 90s. They have a right to expect that they are going to continue to have more time with their loved ones or watch their grandchildren grow up. And to point out, I want to also say again, for those that are in their 70s, 80s, and 90s, which do represent a bulk of the people who've passed away, that the COVID-19 isn't just a disease. Well, it is predominantly affecting older people. We do need to understand that there are 30 people in our state who under the age of 60 who have passed away. And if people say, well, if you're younger, then it's no more than getting a cold or something like that. There have been 450 people hospitalized. 39% of our hospitalizations in our state are people that were under the age of 60. And if you speak to any one of them about their hospitalization and their recovery and how they felt, the pain, the headache, the nausea, the other side effects, COVID-19 is not something that you want to get and live through. It's not something you want to brush off. This is a serious illness for some people, but not for all. But that's part of the insidious nature. We do know that, again, that of the fatalities that we've had, 62% of those have been in long-term care. But that also means that 1 in 3 cases have been outside of long-term care. And if we take a look at other states where community spread began to occur, then that's when you started seeing more death in the community and less death in long-term care. So just because you're not in a long-term care facility and just because you're not over the age of 70 does not mean that you are not susceptible to this. And so again, we want to, again, make sure that we are being smart about how we're protecting our vulnerable, but we also have to work to stop community spread because of the impacts of that. When we take a look across the state in terms of active cases, again, we know that right now that Cass County with 1,099 cases is the first county in our state during the history of this pandemic to pass 1,000 cases. But Burley and Morton together, with 805 active cases in Burley, which is nearly 500 more cases than the next highest county behind Burley, adding the 270 more in Morton County. Burley-Morton, as the metro area, has 1,075 active cases with even a lower population than Cass County. Other counties that have more than 100 active cases include Ward at 324, Grand Forks at 316, Stark at 248, Williams at 247, and McKinsey at 108. And these, of course, are some of our most populous counties, which means that they have some of the most density, which means, again, we have to be on the extra lookout to make sure we're stopping community spread by positive cases and close contacts appropriately, either isolating or quarantining. Our hospital capacity, as we talked about last week with Dr. LeBeau here representing the North Dakota Hospital Association and hailing from Sanford Bismarck. Collectively as a state, we have 241 staffed regular inpatient beds that are available and 32 available staffed ICU beds. Unlike some of the not true national reports that were reported this week, there was some misreporting about statistics. We're not out of beds in North Dakota. We are absolutely concerned about making sure that we keep beds staffed as positive cases continue to rise, because as we need more beds, we need more healthcare workers, and if we have more community spread, the healthcare workers themselves can be sidelined. So again, that's why it's important right now for everyone to do their part to reduce community spread. You don't know if the person in front of you at the checkout line in the store is a nurse working in an ICU unit or whether they're an oncologist working in a cancer ward. But we do know that in our communities, we're often only 1 degree of separation from somebody that is, and that's why it's important for businesses to step up, particularly businesses that have customer contact. There is no reason whatsoever that businesses shouldn't be requiring and offering and supporting all of their employees to wear masks during this time, particularly in counties where we've got higher risk levels. In terms of patients currently hospitalized, earlier this week, this is the restated data that gets accumulated. So earlier on one of our daily sheets, it showed 152 as a high. That's been restated down to 146 because there were some discharges that were not included in the earlier report. But we are below that, back down to 132, down from our peak. But again, these are the highest levels that we've been in. And again, from a percentage standpoint, these still represent single-digit beds in the state of the total beds available that are being used by COVID patients, but we still have patients, whether it's cancer or heart disease or trauma, that need beds. And so again, utilizing our healthcare capacity appropriately, and one way to do that is to keep the number of cases down, and the way we keep the cases down is through individual actions. Let's go next to the county risk levels. As we mentioned last week, as we continue to seek to work with local local counties, local cities to help bend the trend. We're also looking at they had the most impact on transmissible moments, because transmissible moments is the thing that we're trying to limit. We're trying to keep our economy open with a strong and healthy economy that helps families, that helps keep our schools going, it helps everything, keeps jobs, and all of that contributes to the overall health of the state. But we do need to look at the transmissible moments. That's the thing. And based on our contact tracing investigations and reports from long-term care centers that have seen breakouts, one of the things that we know now that we didn't know last spring is that large gatherings continue to be a major source of community spread. And those large gatherings could include even faith-based related gatherings such as weddings or funerals or Sunday church service. These are all gatherings, again, where masking would be appropriate, but where has sometimes been seldom seen, according to the reports from those people who have contracted COVID. But that end, as we've learned more about things that matter and don't, one thing we've also learned is that personal care businesses, such as hairdressing, where you've got one-on-one contact that may be longer than 15 minutes, if both individuals are appropriately masked during the time that they're together, that represents very little in terms of transmission risk. Not zero, but less transmission risk than, say, one wedding or one funeral might represent a large amount of if people were in a closed space, indoors, without masks, versus a number of customers over a course of a day where everybody wearing masks. So with that, we have, as we said last week we would, and today we reevaluated our North Dakota Smart Restart underlying guidelines to better target the source of community spread. And so again, beginning on Friday at 5 p.m., the North Dakota Smart guidelines, which have been updated, they'll be posted at ndresponse.com, are going to have some changes. The critical or red zone, the highest level. This is this area where if we get into this area, this is where we will move back into having to do business closures. Previously, under the previous guidelines, when we got into the high or orange category, that did include business closures. Under the new guidelines, there are no business closures under the orange, but we would reduce occupancy to 25% with a cap of 50 for those that are in orange. And then also, again, we are strongly recommending that businesses and communities, as appropriate in those businesses, require the use of masks for their staff and for customers. Under moderate, which is the yellow, 50% occupancy with a cap of 100, that's down from 250. And again, much stronger guidelines about the use of masks, because again, the lower occupancy is about creating social distancing, and the mask use is about preventing transmission. Both of those things, if you cannot socially distance, then use a mask. And so again, if you're indoors and have a business, you've got customers, these are sound requirements to help build customer confidence and keep your business open. For the low, the green level, that was 75% occupancy. That remains at that level, but the cap has been lowered from 500 to 250. And the new normal is the blue, which there was no changes. That was operating as usual, so no changes on the guidelines. So again, as we talk about who's moving to which counties are moving to which levels, it's important to realize that there are new guidelines that better recognize and understand what we know about transmission. Again, focusing on those things that reduce transmissible moments, such as increased emphasis on distancing and increased emphasis on the use of masks. And we also know that while large gatherings have indeed resulted in spread, not all large gatherings are the same. If you've got an outdoor gathering with a lot of space to do, say you've got a junior high football game and you can get everybody spread out and everybody and all the fans are wearing masks, that's very different than if you've got even a fewer number of people jammed into an indoor space with bad ventilation. So community leaders have to talk with their event planners to submit, to talk about logistics, emergency operations, talk to local health, and work things through, because again, we want to apply North Dakota common sense as we apply these rules, because we know that these North Dakota SMART guidelines are guidelines, and communities are going to have to use their judgment based on the event facilities that they have and the capability they have to deploy PPE, et cetera. And local leaders best know the risk in their communities and will continue to rely on their leadership in defining local parameters. And these recommendations are intended to supplement and guide but not replace local requirements at any time. If a local area wants to have even tighter restrictions, they should certainly consider that, particularly if they've identified through their own local contact tracing sources of spread. And we've seen some of this action like this already taking place by some proactive mayors, where they've identified activities or areas where spread is occurring and are coming up with very practical guidelines. A great one that was offered this morning, for example, in terms of local input by Mayor Brandon Brzezinski from Grand Forks, was on hockey, wanting to keep hockey open. It wasn't the skating on the ice that was creating the problem. It was the extended time in the locker room. So hockey's open in Grand Forks for all the youth leagues, but the hockey players are required to change at home and arrive with their gear or get dressed outside of the locker room to do that. And again, simple little common sense like things, we can keep things moving, but reduce transmissible moments. With these updated guidelines, we're going to be also moving some counties this week. We still have a few counties that are moving in a positive direction, so let's highlight those first. We've got only one county, Steele County, is moving from green or low risk to blue or the new normal. And so they're moving to the lowest level. So way to go, Steele. For those counties that are also going down, we've got two that are moving from moderate risk, which was the yellow. They're going to the low risk or green. And those two counties were Logan and Sargent County. And so, again, well done to those counties. Now we're going to move to a longer list of people that are moving the other direction. Two counties that were at the new normal are moving up to low risks. That'd be Divide County in the northwest and Wells County in the central part of the state. 9 counties are moving from green to yellow or moderate risk. And those 9 counties are Bowman, Foster, Lemoore, McIntosh, Mercer, Nelson, Richland, Towner, and Walsh. And today we are moving back since the first time we've had the five color dial. We're moving 16 counties from the moderate yellow risk to the high risk level. And again, these counties refer to the new North Dakota SMART guidelines. For the guidelines, I covered just the highlights of those, but they're much more extensive guidelines in terms of how that relates to businesses operating in your counties. But Benson, Bottineau, Burley, Cass, Dickey, Dunn, Emmons, Golden Valley, McHenry, McKinsey, McLean, Morton, Montreal, Sioux, Stark, and Williams. A total of 23 counties remain consistent at their current level. So if you were unnamed, you remain there, but 6 of those remain in the yellow status, and 13 in the green, and 4 others remain in the blue. So, and again, as the mayors requested in the letter that they sent, and as we talked about on the call this morning, we are asking the business community, so whether it's local chambers, the state chamber, those business community, we like to have the business community do, again, self-policing among your members for increased diligence in following the North Dakota SMART guidelines and limiting capacity. This is a way, again, where we can keep our businesses open and keep our state moving forward, even as we, at the same time, successfully slow the curve. And again, these recommendations, as I discussed, they include requiring masks in businesses, requiring masks at large gathering. We ask communities and businesses, especially in the yellow and orange levels, to find ways to increase mask compliance, whether it's through incentives, mandates, or other means. Again, we've heard of everything from businesses offering people X% off on their purchases if customers are wearing masks. I mean, there's ways to incent the behavior that you want to seek to keep COVID out of your business. And again, the key and the goal behind all of this is twofold. When we talk about saving lives and livelihoods, the saving lives is obvious, and with livelihoods, the key to both of these is decreasing transmissible moments. Keep that in mind when we're thinking about all of these potential guidelines. It's the points of contact between people that are unmasked and at close distance, particularly in unventilated spaces when people are talking more loudly to each other or singing. That creates more aerial droplets. We know that that's how this is spreading, and so let's figure out a way to reduce those. Okay, I want to jump over and talk a little bit about schools for a second, because as we continue to adjust our response as we need to this, the ever-changing disruptions caused by COVID-19, we want to continue to support our schools, and we have to do that in a way which allows them to continue on this strong path towards in-person learning. We know now from many studies, including one recently released with over 200,000 students, that the infection rates, schools are not turning out to be any kind of super spreader events that people thought they were. And so this is fantastic for our children and for the educational community. And we know the importance of schools because it's not just education. We know that in our state, they're also delivering health care and mental health and nutrition services to tens of thousands of students. And we know that when in-person learning occurs, benefits happen. And we know that when students are not in school, right now, being in school is probably the place that from a pandemic standpoint is one of the safest places they can be because of the high mask compliance. So what we want to make sure we get clear today is that when some of the school boards approved their plans, they tied their school plans to the county color codes. The decisions that we're announcing today about moving color counties up particularly relates to large gathering and business models. It does not repeat, the change of color codes does not relate to any recommended or desired changes in the instructional models within schools. In fact, perhaps the opposite. Regardless of the color coding of your county, we believe that you can actually reduce transmissible moments by keeping students together with their cohort groups, which means keeping kids in school and keeping them there 5 days a week. So we know that school closures have a dramatic impact on students, their families, employers, and it also school closures can increase transmissible moments. So right now, we want to continue to support our K-12 schools as they're implementing mitigation strategies. Many of them are continuing to move forward successfully towards that. This Brown University study that I'm referring to, 0.13% of students and 0.2, so that's like 0.1% of students and 0.2% of staff were infected in the last 2 weeks of September, and that looked at over 200,000 students attending in person from 47 states, including North Dakota. So again, great job to the schools on implementing a safe return to school. So again, in recent weeks, the North Dakota Department of Health, in partnership with the Department of Public Instruction, had the Healthy Return to Learning team. This team was comprised of subject matter experts that are working to support schools, leaders, and educational staff. And that team has developed a living document that's going to be updated. But in some cases, school districts may need to take a look at their own plans they've adopted to disconnect their instructional model from the county color codes. Next up, we want to talk about long-term care visitation, which is an important topic in our state, and long-term care and the Vulnerable Protection Plan has been doing great work across the state, and now we're faced with these additional challenges and more infection and more death than we would care to have. But here to talk and give an update on long-term care is none other than Chris Jones. Welcome, Chris.
Thank you, Governor. Skilled nursing, basic care, and assisted living facilities across the state of North Dakota have faced countless impacts as a direct result of COVID-19. Nonetheless, as community spread has continued to transpire, there has also been a direct parallel with increased cases occurring amongst both healthcare workers and residents whom are residing within these facilities and where our state's most vulnerable population resides. The state's approach to keeping all levels of care under the same guidance has been vital to mitigating the spread of COVID-19 amongst our vulnerable population. During a recent visit to North Dakota, Dr. Birx praised the state for including assisted living and basic care facilities within the robust testing plan and the associated visitation service guidelines. Additionally, many of our state's facilities house the full continuum or multiple service lines within a single building, thus making it difficult to differentiate the restrictions, and it's extremely daunting to achieve as they try to share that information with families. Despite the rise in cases, North Dakota has continued to be a national leader in allowing for the early reunification of residents with families through various visitation platforms. Back in early June, the North Dakota Smart Restart long-term care reopening guidance was developed with clinical oversight in order to ensure that a North Dakota smart, safe, and resident-centered approach governed the gradual reopening of these congregate living settings. It is important to note that this was nearly 3 months earlier than any federally driven easing of visitation restrictions. Every modification and advancement in this plan has been made while taking into consideration the need for balancing safety with an individual's psychosocial well-being. Furthermore, and I must stress this, the state has always given the facility administration the autonomy and discretion to adopt more stringent guidelines, including limiting the amount of visitation within the facility. So said differently, right now, of the 215 facilities in this state, 195 are allowed per the state through the EO, through the plan, to do indoor visitation. It is not the state necessarily through the EO or the plan that is restricting limitation. The facilities are making determinations to restrict visitation. And they're doing that for a number of reasons, and we work with them on a regular basis, but some of it is related to the increase in community spread. We continue to work with them and their families. The state, it is very similar to when hospitals or group homes decide to restrict visitation. The state does not, rarely gets involved with restriction of visitation there. So as of right now, even though we include all 3 of the service lines, assisted living, basic care, and SNF, in our guidelines, 195 allow indoor visitation. In light of the most recent guidance released by the Centers for Medicare and Medicaid related to testing requirements and visitation for nursing homes, key North Dakota stakeholders have been working to update existing guidelines for nursing home visitation. Nevertheless, as a direct result of North Dakota's proactive approach to reopening, our current visitation and service guidance is far less stringent than the new mandates from the federal government. In fact, just this week, the Long-Term Care Association reached out to our sister states of South Dakota and Minnesota, who confirmed that our visitation guidelines are far less restrictive in nature for skilled nursing facilities. Therefore, we are currently engaging in conversations with CMS leaders to request modifications to align more closely with our current guidance and to avoid any regression in visitation. We wholeheartedly recognize the need to balance nursing home, resident, and staff safety with their quality of life. Balancing COVID-19 safety and visitation restrictions with the well-being of residents in long-term care and other congregate living settings is an urgent priority for North Dakota. Social isolation because of COVID-19 visitor restrictions is a significant concern, and thus why our state is engaging in this critical dialogue with CMS to solidify our ability to allow for safe visitation with adherence to the necessary universal source control measures. Said differently, right now 195 facilities have indoor visitation. All facilities have outdoor visitation. If we have to adopt the CMS guidance, 12 facilities will have indoor visitation. So we are working very hard to adjust these standards moving forward. Minnesota just announced moving to this standard. They did not have visitation before. So I want to make it clear, we are very open and focused on making sure that we keep residents safe, but family visitation is a key tenet to everything that we do. So while COVID-19 remains a significant concern in communities across the state, we will continue to collaborate with the federal partners, long-term care associations, key stakeholders, including residents, on how to ensure responsible modification of restrictions for long-term care facilities are made. Our guidance is always based on best practice recommendations and evidence-based decision-making. And today on a call with CMS Administrator Seema Verma, she did applaud the state of North Dakota for continuing to be creative in how we are approaching visitation and long-term care. Therefore, guidance will likely be updated and adjusted as additional information becomes available or response efforts involve. And on behalf of all the long-term care facilities, on behalf of all the local public health, everybody who's working on this, visitation is a key component to what they are trying to achieve. So we just ask, this is not something that the state has restricted visitation. We need to work with the facilities and the families to safely allow visitation within those facilities. Thank you.
Thank you, Chris, for being such a strong advocate for long-term care residents and families, and thanks for all the battles you're fighting with the federal government to allow us to keep on North Dakota's good path. The next topic, as some of you may have heard, the U.S. Census. We've talked about it here frequently, how important it is, but the U.S. Census is ending early, and it's ending tonight at midnight. This is your last chance to do your part. You still have time. If you and your household have not filled out your census, you're missing out on an opportunity to help yourself and your community and help North Dakota get the appropriate levels of representation and federal funds for the next 10 years. So again, if you've not submitted your census, internet self-response will be available across the nation through October 15th at 11:59 a.m. I guess it's, and so anyway, that's Hawaii Standard Time, okay, so get that. So then you got to back it off from there. But we are, I think that's what, 5 a.m. Central Time. Tomorrow is when it would close. So you've got more time, because tonight it's midnight in Hawaii, so then that's a little longer here if I'm reading this correctly. Anyway, you don't have to wait, but you don't have to wait till midnight. You don't have to wait till 5 a.m. You don't have to go to Hawaii. Of 2020census.gov, you can respond right now if you have not. On behavioral health, which we've talked about at each of these sessions, we know how important that is. Students and family across North Dakota have been impacted during the pandemic, and one specific area of concern is the behavioral health of students. Today, the Department of Human Services Behavioral Health Division announced that it has awarded funding for the expansion of children's behavioral health prevention and early innovation grants to two schools, Dunseith Public School and Barnes County North Public School near Wimbledon. And these schools were each awarded up to $75,000 to build a comprehensive strategy to improve children's behavioral health. Prevention and early intervention are keys in creating a system that supports a child's overall mental well-being. These grants are an expansion of a pilot project that was very successful, and it started in 2018 at Simley Middle School here in Bismarck. Representatives from Simley will play an instrumental role in rolling out the expanded pilot program by sharing lessons learned and also by mentoring representatives from Dunseith and Barnes County North next year. We're grateful for the foresight of the legislature last session in providing for additional funding to expand the behavioral health pilot grant to include a rural school and a tribal school. The Children's Prevention Early Intervention Pilot Program is an important step, and we in the schools are taking to ensure and help protect the behavioral health of our students. The behavioral health also offers many resources at no cost to schools and community members to support the behavioral health of children and families. As you go through this pandemic, that's available through the Parents Lead program at parentslead.org. When we talk about upcoming events that we share our gratitude for, one is Recovery Reinvented. We're grateful for the efforts of the First Lady, the Recovery Reinvented team, and the great behavioral health team at the Department of Human Services, who will be scheduling their 4th Recovery Reinvented, and that's coming up on October 28th. And you can reserve your spot now. It's going to be a virtual event, but you can reserve your spot now at recoveryreinvented.com. Thank you. And closing out with gratitude, we've signed some proclamations this week that are very fitting. This is October 11th through the 17th, the week we're in right now. It's both Emergency Nurses Week and it's Healthcare Security and Safety Week in North Dakota. And this week we share our appreciation, our gratitude with those who serve on the front lines of the healthcare system, nurses who have, from the very beginning, put themselves in harm's way and leaping into action as patients enter our hospital in emergency conditions, and the men and women who maintain the order and safety in high-stress environment. As the COVID-19 pandemic places even greater stress on our healthcare system, we are grateful for the work of these professionals, both the emergency nurses and the healthcare security and safety team. Thank you both for your incredible work. And in closing, with a gratitude quote for today, 89-year-old South African, who we all know, Cardinal Desmond Tutu, said, "A good deed doesn't just evaporate and disappear. Its consequences saturate the universe, and the goodness that happens somewhere, anywhere, helps in the transfiguration of ugliness." I think about the spreading of good deeds as we open today, talking about love thy neighbor as thyself. This is an opportunity to do some good deeds in terms of helping protect the health and well-being and economic well-being of your community. And when you do that, that won't just evaporate or disappear. The consequences of those good actions will saturate the universe, and goodness will happen somewhere, anywhere, and you may, in fact, have an opportunity to save a life. So with that, we'll stand for questions. We're going to go online today first.
Jean Shemp, Hometown Radio Group. This week's White House report has North Dakota as the top in the nation for deaths per capita and #1 in the nation for new cases per capita. Why isn't this information shared more publicly? Is it because it underlines how serious things have become in North Dakota to the public?
Well, question from Jean. This information is shared publicly. The White House reports are available, and it is a fact that North Dakota does have the highest cases per capita. It's also a fact that North Dakota has the highest testing per capita. And so when we're doing testing not at 5 or 10% more than other states, we're doing testing at multiples higher. Then this is a reason why we end up in this statistic of having the highest cases per capita. We're probably going to be with that for a long time because of our low population and high testing. That even if we got our positivity rates down substantially, we still could have a very high number of cases per capita because of the low population and testing. The deaths, of course, again, also translate to that. As we've seen our deaths increase in recent weeks with the small population, we have in fact had a high number of deaths per capita, and that's obviously something that we take super seriously and what we're working to try to prevent. We'll go over here. We'll go to Jack.
I'd like to drill down on your statement that public health is based on individual choices and individual actions. The state of North Dakota has school immunization laws, water quality standards, laws against the transfer of bodily fluids, and as of this year, rules related to what homemade foods are authorized for sale. Next month, deer hunters in North Dakota will have to wear at least 400 square inches of fluorescent orange or be subject to a $50 penalty of a Class 2 non-criminal offense. How is a mask mandate different than any of these measures?
Well, I think that you bring up the sort of the long history of public health creeping into into regulations. I mean, I'll go back to my grandfather, Dr. Kilburn, who in the 1920s moved to Fargo 40 plus years before I was born and was the first public health official in Fargo. They were working on things like trying to get people to stop having outdoor bathrooms in their backyard and tie into city sewer and water sanitation systems. The concept then of washing your hands was not widely known. Now I think anybody that goes to a restaurant, sees a sign that says employees are required to wash their hands before they return to work. We see those signs. But when you read that sign, you probably say to yourself, who's here to enforce that? Because a number of the things that you described all raise the question of, yes, those things are on the books, but is there enforceability of those? I don't think with the, the 20 or so we have, game and fish rangers that we have and game wardens we have in the state of North Dakota that anybody's ever pulled out a tape measure to ensure that whether they've got 400 inches of orange on or not.
17 people were cited last year for that.
Well, they might have been wearing 0, and maybe they got cited. But I'm saying I don't know that we're in a position we don't have the enforcement capability collectively. So whether these things are, as you say, written in law and finable and still not followed by everybody, or whether they are, it came down to the individual choices of the people that either wore orange or didn't, the people that washed their hands or don't. So I think it's safe to say, in the end of the day, you can have all the rules and regulations you want, but it's what people do that will stop the spread, and so I think that's the key. That's the tie-in with all of this. Human behavior matters, and it matters particularly in public health. And I think again, if you're really asking about mask mandates, the one thing we know is that masks work. That's not clear evidence that mask mandates work. We've talked about that at prior conferences, where depending on the culture and the nature and and even today the political balance of a state, you might have better chances of masks working or not working. And of the states with the 15 highest positivity rates in the country right now, 7 of them have mask mandates, 8 of them don't. And so again, even if you look at that data, there's no conclusion. Masks work, mask mandates is inconclusive. I'm going to go to Jacob and then back to Jeremy and then to Dave and then Tom.
Governor, which came first, the changing of 16 counties to high risk or the guidance for high risk, and what's the reasoning for one changing before the other?
Well, I think they came simultaneously. We signaled this last week when we talked about the fact that we were getting, I think, smarter collectively as a state, as a nation, about where transmissible moments are occurring. And so we wanted to make sure if we're going to move people to the next level of higher risk, that when we did that, that the guidance that went along with it actually was effective, as opposed to, harmed businesses but didn't slow the spread. So I'd say if you're going to have a slight one beat ahead of the other, the regulations changed first, because that then creates a framework for moving people up to a new, updated, smarter set of guidelines.
Doesn't that kind of change the goalposts, though?
Well, no, I think it doesn't change the goalposts. The goalposts are, saving lives and livelihoods, and this is shows our willingness to stay curious and make improvements as we learn more about COVID. And it also, I think shows the humility that when we made some of these rules last summer, we didn't know everything we know today. And so we want to keep adopting and moving forward, being as smart as we can and applying North Dakota common sense along the way. Jeremy?
This one sort of follow-up to Jacob's question. I just want to make sure the orange level, those are not requirements, those are recommendations still.
Those are recommendations, and they are, but I would say again, they're made with an ask. Today, we're making an ask of those counties and the businesses within those counties to look at those guidelines, and we're asking the business community to step up and collectively help reinforce the idea that when everybody takes these steps and we can slow the spread, that is our path towards having a more free, having back the life that we want to have back. The path, as I say, to freedom is through this self-discipline and these small actions of individuals and businesses. And so we're asking, it is a recommendation, but it's a ask in the strongest way possible from myself personally and from the state of North Dakota.
And then the question I actually had written down here, what was the feedback you received from mayors today regarding increased mask wearing, messaging, and mask mandates broadly?
Well, I'd say that there's a mix across those mayors, and some of those mayors clearly would be in support of a statewide mask mandate because that would take some pressure off of them. Some cited that if a city does it, but the county doesn't, it creates some inequities. Some people like the balance of a statewide approach, and others would be completely in line with the idea that, hey, we've got to get the business community to step up, and others are aligned that saying mask mandates would create a sideshow of resistance that may draw us away from the attention needed to actually fight the pandemic. And we really don't want to be in a position right now. This is not the time for us to be fighting ideological battles. This is the time for us to come together and fight a pandemic and do that together. And we know that masks work, and you don't need a mandate to wear one. You can choose to do that because of, again, your love for community and your love for your school, your love for your family, the love for elders. You can just choose to do it. It doesn't require a mandate. Nothing stopping people from doing that.
That advocated for a statewide mask mandate?
I won't speak on behalf of the mayors. Feel free to talk to any of the mayors, and because each of them are also dealing with their own internal political situations as well. Dave?
This is for Chris Jones.
Okay, thank you, Dave.
It's more of a clarification question. If CMS does not agree with North Dakota, what kind of hammer do they have on us? What consequences?
So the way it would work is they would be directing the Department of Health to do surveys, and they would be getting certain survey citations, which will ultimately impact their reimbursement, and then ultimately, I mean, you can only have so many citations going forward. So they would be put at risk that way.
Is it your feeling that they're going to be willing to maybe bend a bit?
As of today's call, they are interested in our creative solutions and meeting our needs in a comprehensive approach based on everything we've done up to this point. And we feel like we have enough data to show that what they're suggesting isn't going to be any safer than what we have been doing, and will be able to continue visitation going forward.
Question back here.
DIY, talking about mask mandates again. I mean, you've asked people to be North Dakota smart. Apparently not everyone is being North Dakota smart based on the levels going on. You say they're not enforceable, but judges have upheld them across the country, and people challenged your business closures back in the spring, and they were upheld. Why don't you think they can be enforced this time?
Well, thank you, Matt, for the question. I think that they can be upheld in a court, but that's different than actually that there's enforcement action that you're going to be able to get every person to wear a mask, particularly people that don't want to wear masks. So it just seems like common sense in North Dakota that when we can achieve greater mask compliance by people choosing to do things, have their own reason for doing it as opposed to being told. I think you all know, anybody that's raised kids, I mean, sometimes, you tell a kid to do something, they want to do exactly the opposite. I think as adults, we don't lose all of that, particularly in a state where we love our freedom. And so it's I think, again, imperative on us to continue to find incentives for people to want to wear, whether that incentive is a sense of caring or a sense of self-preservation, find those incentives versus trying to, keep coming up. I mean, we need more carrots, more empathy, more compassion, more understanding. We don't need bigger sticks because I think we know that at least in North Dakota, bigger sticks don't work, and we can look to other states that have positivity rates of plus 20% with mask mandates in, and we can know that a big stick is not a magic bullet to make this virus go away. No, it's a understanding of what works for North Dakota and what doesn't, and I think that's how we've guided this way all along. We've tried to really drive this. We've tried to keep the ideology out of the room and the data in the room. And if you said to me, every state that's put in a mask mandate has somehow magically had the virus go away, we'd have one. But plenty of states have had them, and there've been, like I said, sideshows that have distracted away from again, you end up fighting a fight over ideology and civil liberties, as opposed to a fight over actually fighting the pandemic, which is what we want to focus on. We're going to go to the back, and then we'll go online.
Renee, KX News. You said today we need to acknowledge the steep upward trend lines in a lot of directions, but that's been happening for about 2.5 months now. What's your threshold or a line in the sand, per se, for when we do something more, as in going back to passing an executive order rather than guidelines? Our strictest measures were taken back in the spring, but admittedly, we knew a lot less about the virus. But as things continue to trend in the wrong direction with no end in sight, is there a point where personal responsibility is not enough anymore? Is there a threshold or date to hit, and what is that?
Well, thanks, Renee, for the question. We don't have we haven't drawn a line in the sand that says, that if we get to X, Y, Z, then we have to take more action. But we have in the county guidelines, you can see that when a county gets to the red or critical, that does include business closures. So I think that people can look ahead and say that if in a particular part of the state they're not able to reverse the trends in their county, then if we get to the red, then you'd be in a situation where you might be back into having to take more firm measures, which is why, again, we're inviting people to take the action they need to today at the local level, to us avoiding have to do what we did last spring, because like I said, we're smarter now. The other thing, which again, you can't be absolutely conclusive on this, because we have had points in time in counties where we've had a high number of cases, but when you get 87% of the cases at one point in September, like in Grand Forks, where 87% of the cases were between 18 and 29, and there was almost no one hospitalized in Grand Forks County, you have to look at all of that data. And it's not just the number of cases. It's not they were among the highest cases per capita in the country, but there was no reason to suggest that we needed to close anything at that point in time, because there was no pressure on the hospital system. So we have to look at all of those different components when we're making these decisions. But I think with the revised guidelines you see today, that anybody that's in the higher risk is going to want to, those localities, those businesses, those cities are going to want to take the steps they need to reverse these trends. And when you're characterizing your question, you said steep. I wouldn't call going from where we were to today at 7.8 or 5.8 to 7.8 is steep. It's been steady. It's been going the wrong direction. I've called it a dangerous trend line. All that's true, but I wouldn't characterize it as steep. I mean, some states have gone from 5% to 20% in a very quick time. That is steep. We've managed to avoid that here in North Dakota. We want to make sure we avoid that.
If we get into the holiday season and we're still going upward, no matter how steep, there's no point where we'll go back to kind of what we did in the spring?
I haven't said that. I've said all along that, we'll use every tool in the toolbox we need to make sure that, save lives and livelihoods. And right now, if we can, preserve healthcare capacity, protect our vulnerable, and keep the economy going, then if we can balance all those things, we'll continue to try to find that balance, because that's the way to protect the holistic health of everybody: mental health, behavioral health, economic health. We're going to keep trying to drive that path. Okay, I'm going to go online, and then I think I got to catch Tom before I come back here to Matt.
Scott Hennon, WZFG KFYR Radio. Over 50% of North Dakota is now orange, meaning significant reductions in capacity guidelines. Have you talked to the businesses and/or the churches that now have to limit capacity to 50 people? What advice are you offering?
Well, the advice I would offer to those folks is to make sure that people in those communities are doing a better job of wearing masks, particularly employees within those businesses, and that we're, making sure that if you're in the service businesses, some people built some really robust, takeout type businesses. And I think that, again, that we're back in that. But when we've got higher cases than we had last spring, it requires us changing the guidelines. We needed to take action today, and I think that we heard from mayors today that some stories of businesses acting very responsibly and other businesses really hosting events that generated, large crowds and spreader events. And I think that, again, mayors are going to know at the local level, and we had mayors on the call today that left the call with action items. I'm going to go talk to XYZ business about their practices because they can be a part of helping protect our community. So those discussions have to happen and will happen at the local level. Business by business. Okay, Tom, and then Matt, and then Jack.
Governor, back on the issue of a mask, you have been asking people to wear masks for months now, and increasingly in the last couple of weeks with more intensity, but they haven't been listening. Are you afraid that if you were to actually order masks, that you wouldn't be listened to, and that people would violate that order? Is that something that worries you and is contributing to your not ordering a mask mandate?
Tom, I wouldn't say it worries me. I think it's just a fact. There are some people in North Dakota that are very clear that they're not wearing a mask under any circumstances. I can't speak to their belief system that leads them to that conclusion, but especially under any circumstances. I mean, if you're in rural North Dakota and you're farming and you don't have any interaction other than with your household contacts and you're socially distanced all the time, there may be no need for masks in your life. But if you're someone that works in a business where you come in contact with a lot of people, if you're a server in a hospitality business, if you're and I think we've seen of some fantastic compliance among teachers and students. I mean, I think one of the reasons why those incredibly low rates that we're seeing from that Brown University study, which included North Dakota schools, is because in schools, kids get it. I mean, they're wearing masks, and and part of the reason they do it is because they want to come to school. University students are wearing masks because they want to keep coming back to class. They want to do that. So I know that there's some that won't, but I don't spend a lot of time worrying about that. I think if we can get the majority of North Dakotans to understand, and the majority of North Dakotans to do that, that will be enough to help us bend the curve.
So the question is the idea that they will not follow your order factoring into your decision not to make the order?
I'd say no. What's factoring into my decision is that other governors in other states have put in mask mandates, and they haven't, and it doesn't necessarily lead to increased compliance. Increased compliance comes from, you can't, walk into someone's house and wrestle a mask on them. I mean, that's not going to happen. People will put on a mask by themselves. They'll take it off by themselves. I mean, I'm amazed that we're still having this debate because there is no other way to get someone to wear a mask other than for that person to choose to do that. And if a business says you must wear a mask to be a customer in here, a business can say to someone, thank you, you're not allowed in here because just no shirt, no serves, no shirt, no shoes, no service. How about no mask? I mean, businesses can choose to do that. And so that's where that can happen, local level, individual level. Okay.
It's more effective if it's a mayor or a business calling for them than the governor?
I haven't seen the data on that specifically of whether local mandates have higher compliance or not, but my intuition is that the closer they are, like if there's a university says you can't get into this building to class unless you're wearing a mask, that's probably pretty effective. You probably get 100% compliance if a kid wants to go to class. So I think there are ways. I think when you get the more distance you get from the individual in the level of government, the more the discussion becomes ideological and less becomes a practical thing about slowing the spread. Back to Matt, and then Dave. Did you have your hand up again or not? No. Okay. Matt, and then Dave, and then online, and then Jeremy, and then Renee.
You continue to sort of downplay some of these national reports talking about the COVID situation here In North Dakota, you blame a lot of it on the increased testing that we have. We have higher levels of testing, but the positivity rate just continues to skyrocket. And medical experts, including Dr. Fauci, say the positivity rate doesn't lie, and that should not be rising because of increased testing. Why is your thinking different than Dr. Fauci's?
Well, it's not different than Dr. Fauci's, but let's pull up a slide since we're diving deeper into this. Because, I mean, again, the words skyrocketing, I'll challenge that here. This is a, trends in hotspots, and I got to look back on this thing. But the thing that everybody's, talking about skyrocketing, this is a comparison to other states when they're at their peak. We're at our peak. We have our peak number of cases this week. So these are what other states were. So New York had a 48% positivity rate, 45, deaths per 1,000 cases, and a hospitalization rate of 30%, and they were doing 653 tests per 100,000. Compare that to North Dakota right now, where we're at 8% positivity, 1/4 of that in terms of deaths per 1,000, a hospitalization rate that's 1/10, and we're doing almost 7 times as much testing as they were when they were at their peak. And then you can just go down the line and take a look as it moved to the south over the summer. So, like with Arizona, that was in late June with their positivity rates at 22% and testing at about 1/4 of what we're doing. Florida and Texas, again, with rates more than double. And so this is where we don't want to go. I mean, this is why we're saying today that we have to be smarter about the guidelines we put in place. We got to be smarter about businesses and communities, taking them seriously, faith-based organizations. They've got to follow the leads of the school. Schools are open and doing great because they're practicing social distancing and masking and hand hygiene. I mean, we can look to our own communities and say, have we had a big outbreak in any of our schools yet? No. And so that's have you read about, some headline around the nation where there's a devastating outbreak in a school district? No, there have been cases, but not these kinds of outbreaks. And so this is, again, an example of where we don't want to go and where we're in a position now where we don't like the trend lines, but where we can still, we need to stop where we are and start going back down again. Dave's okay. We're going Jack, and then online, and then Renee.
Hospitalizations reached a record 158 this week. We've talked a lot about field hospitals in the past, but what's your long-term plan for hospitalizations as they continue this steady rise?
Well, let's first, when we shared the hospitalization earlier, there was some restating because there was some missed discharges. And so the peak, I think now for hospitalization is 146 is the new restated high for the state. We're down to 132. Again, capacity, because we've got a strong healthcare system in North Dakota, and as I said, we've got hundreds of beds open available today. And I did get a message from Brian Niermo, who leads Sanford and Fargo. He was describing their efforts to add capacity, bring on 24 more beds. And so we've got the ability to continue to grow. You heard it from Dr. LeBeau last week. If we're going to grow healthcare capacity in North Dakota, particularly as it relates to hospitals, we want to do that within the walls of the hospital. That's where we can do the best infection control, the best staffing, all of that. And we'll continue to work with our hospital system and our hospital networks to make that happen. I don't see field hospitals in our future. If we started heading towards having that kind of constraint, then you might have to execute what other states have done, which we didn't do last spring, which is ask hospitals to limit, elective surgeries and other things to free up capacity. But we've been able to manage both regular healthcare needs and COVID healthcare needs simultaneously. That's a credit to everybody in healthcare. But one of the constraints, it's not just physical beds, it's staffing. Staffing, they live in the community, they work in the community. We need to make sure that if we're practicing in these communities with the high positivity rates and the high case numbers, part of the reason why we need to mask up and social distance is to protect the healthcare workforce. Okay, we're going, what's that? Okay, well, yeah, Chris has got another point which I'll just throw out, which is, I mentioned it in my opening remarks, but last spring we had almost 20 days was the average stay initially for a COVID-related patient. Now in North Dakota, it's down to 7.1 days. And so so when we look at the numbers on that slide to say that our peak was 146, we're down to 132. If we're going to do more sophisticated look at that, one patient that stays for 20 days last spring is the same as one patient that is now today for 7. That'd be the same as 3 patients for 7 days. So if a hospitalization is 1/3 in length, in part because of what we're doing with the treatment approaches that we have today that are better and more effective, we've actually in some ways tripled our hospital capacity since last spring without adding any beds because the length of stay is shortened. So that's another area where we're freeing up capacity. And again, as the therapeutics and the treatments get better, maybe we can continue to see those length of stay drop even more. I'm losing track here a little bit. I thought that, I think I committed to Tom and Renee and online.
There was some good news today amid the difficult news of COVID-19. Over a year and a half ago, you came out to Williston with an education summit to challenge the Williston schools to make solutions for their overcrowding. Today, District 1 and District 8 presented their reorganization plan to the state to the state school board, and they voted positively to allow it to go to vote. Is that what you wanted to happen? And what do you say to those people in Williston now that they have come up with their own solution?
Well, I would say that what we wanted to have happen was collaboration between District 1 and District 8, and that happened because when that collaboration occurred, the ultimate plan is the one that should have been decided on by those 2 school boards and those 2 school districts. But the collaboration that they came together, I think that all the adults in the room showed that they really cared about students because the way we were going was going to be tough on taxpayers from a property tax and tough on students. And so I think it's a positive example. School reorganizations are some of the most emotional, difficult things you can imagine outside of COVID. I lived through one between Arthur, Hunter, and Erie when I was a 6th grader, and I said at that point I learned everything you could learn about politics going through that. My mom was the president of the one of those school boards, and so I know how difficult it can be, but I congratulate everybody on both sides for finding and seeking a solution. Good news, and good news for recruiting workforce to our state, because one of the first things that people look at when they're deciding to live in North Dakota is whether or not they've got a school system that makes sense, and this collaboration will do that. Okay, Renee?
So we talk a lot about data in North Dakota, and it's obviously an important key step in the scientific process. One thing we still don't totally understand is immunity and how likely we are to contract the virus a second time. And as that starts to show up in the U.S. this week, we've seen several cases of reinfection. Is this data that we're tracking right now in North Dakota? Are we going to begin tracking reinfection data?
Yeah, we'll certainly keep an eye on that. We haven't had a reported or confirmed case of reinfection in North Dakota, and I'm not surprised that it's possible to have a reinfection. I mean, we were talking about millions and millions and millions of cases worldwide, and now there have been a few cases. I mean, count them on one hand, kind of number of cases of potential reinfection. I don't think that would change our core strategies in terms of how we're approaching this, but it's certainly something we'll keep our eye on. 2 more questions, and we got I think we got online, and then is it a battle between Jeremy and Matt? I don't know whose hand went up first. He's giving it to Matt. Okay, all right. So online, and then Matt.
Jacob Orledge with the Tioga Tribune. Can you clarify what the high risk and critical risk levels recommend and what those risk levels mandate under the Smart Restart Plan?
I would just guide the question, and thanks for dialing in from Tioga. I'd guide the answer to that question back to ndresponse.com. All the risk levels are out there. They're far more detailed than what I presented here. And apparently I was told that one of the things I said was slightly different than the slide. So go with the slide and go what's on ndresponse.com versus what I might have said when I was walking through the slides, because what'll be online is the accurate information. Okay, Matt?
Risk levels for each county. You have one set of data. The for example, in Grand Forks, they've been compiling data there. They put Grand Forks in the orange. Is that sending a mixed message on how to handle the pandemic when you have the state and county level at two different ball fields?
Well, I'm not familiar with Grand Forks' criteria, so I can't comment on that. But we're focused on trying to consistently apply the analysis across all the counties in the state, and so this is what we're going for. And to the degree there is a discrepancy, I mean, I'll take that as an action item that we should visit with Grand Forks County to see where the differences might be. But again, we always encourage if local communities feel they want to take more or new or creative mitigation strategies, we're happy to learn from them and happy to support them.
Because obviously they don't want to overstep what the governor is saying at the state level.
Like I said, I can't comment on what their levels are because I'm not familiar with their criteria was, but we'll certainly have a visit with them. But again, thank you all for your many questions. Thanks all for being here today. Stay healthy, stay happy, stay safe.